Then from your practice, I mean, over 20 years, just dealing with issues and matters of infertility, what would you say is the really main cause of infertility amongst couples?
Yeah, so if you look at the causes of infertility, we can categorize into the female causes and the male causes.
So it's different for the genders?
For both, yeah. Okay. So in the female, there could be a problem with the reproductive organs, like there could be problem with the uterus, there could be problem with the ovaries, or there could be problem with the tubes. So if you look at the uterine factors, like the factors which can affect the woman not to get pregnant, what I see in Kenya, fibroids are very common here. I think I would say almost 1 in 3 or 4 girls have fibroids, and mainly the reason could be genetic only. So if there
are... the reason for fibroids could be genetic?
Genetic, okay. Yeah, because it's usually passed on from mothers to the daughters. Right. So that could be the main reason, plus there could be some environmental factors or other factors, but genetics is the main reason. So I see every patient I get, almost every second patient comes to me with the history of fibroid, and they have undergone surgery, not even 1 surgery, but maybe 2 or 3 surgeries, because the fibroids can regrow. That is one of the important reasons which we find in the uterus that can be the reason for infertility. Now, the fibroids, not all the fibroids cause infertility because, there is a space in the uterus where the embryo has to grow. If the fibroids are occupying that space, the fibroids can be in the cavity, they can be outside the cavity, they can be in the muscle, they can be multiple, they can be single. So the fibroids which are actually occupying the space where the baby has to grow, that is when we need to look into it and it needs to be removed. Okay. And the other reason the fibroids can cause infertility is that they take away most of the blood supply from the uterus. So the blood supply to the embryo gets compromised and they are not able to conceive. That is one reason in the uterus. Then there could be, if somebody has undergone DNCs like miscarriages or abortions, there could be adhesions, there could be infection in the uterus which can prevent the implantation of the embryo. If you look at the ovarian causes, like in the ovaries, there could be, a woman has to have 1 good egg to get pregnant. So if she is not making a good egg, that means she is not ovulating, then that can lead to infertility. And the main reason in the young girls which causes anovulation, meaning they are not ovulating, is the PCOS, which we are seeing a lot in young girls nowadays. And the causes can be many, like it can be the genetic factors, it could be the diet, the stress, the obesity. There are a lot of factors which can lead to polycystic ovarian disease, in which a woman has a lot of hormonal imbalance and they do not make a good egg. So they will need assistance to have good egg first. Is the thing that we suggest people who do not get regular cycles. Like, you'll see the girls skip cycles for 2 months or 3 months, especially in the PCO. Yes. So we tell them whether you have to take tablets on a regular basis.
Have very lengthy flows.
Yeah, okay. Yeah. So they should, their main aim should be to get the regular cycles, to get your hormones regular and ovulation.
All right, yeah. I hear you. So at least now we are clear.
That should be the goal.
We know better.